If you were here this morning, we got to hear, just so we can summarize, from ASCO on drug shortages, ASH on palliative transfusions, and from American Cancer Society on a lot of their efforts to make care affordable, and also on cancer prevention. So just opening the session that CAGLA, if you aren't familiar with the organization, Cancer Advocacy Group of Louisiana, this advocacy session is sponsored particularly by the lobbying group that CAGLA work with. That's the Picard group that is behind me. And Nick Waltz, he actually spoke this morning on what we're planning on putting forth to state legislation this year. Bills, one, that would support dental coverage, dental screening coverage for cancer patients. So why that came into play as a topic that CAGLA is going to kind of promote to the state is because there are certain cancer therapies. One would be head and neck cancers, where someone may be having surgery or radiation therapy that's going to include the area of the mouth. I'm a hematologist. I'm Dr. Laura. I didn't even introduce myself. I'm Dr. Laura Finn, a hematologist from Ochsner MD Anderson. My co-chair is Melanie Sheen, a breast oncologist for Ochsner MD Anderson. This dental care issue is important for me as a hematologist because patients with multiple myeloma, they have to get dental clearance to be able to get bisphosphonate therapy, so they're not at as high a risk for bone fractures from their multiple myeloma. And then also patients with any type of blood cancer that's going to have a stem cell transplant needs dental clearance before the transplant, so we know they're not at an infection risk. And especially for our Medicare, Medicaid population, getting dental coverage, affordable dental coverage is an issue. So we're actually going to take it to state legislation to have Medicare, Medicaid coverage, hopefully for dental evaluations, specifically for cancer patients where it's necessary to advance their care. And then a second bill that CAGLA is going to take the torch up on is coverage of supportive care services. And this is where I was actually asked by Nick Waltz, our lobbying group, because one of our state senators, she actually covered our CAR-T bill. Believe it or not, the state of Louisiana, CAR-T, chimeric antigen T-cell receptor therapy. What it is a pretty unique cell therapy that is a curative therapy for myeloma and relapse refractory lymphoma. We're one of 7 states in the nation that now has it covered by Medicaid because CAGLA had that bill passed. And not only was it passed, but the first Medicaid patient was actually treated about 4 months ago and is in remission. So not only it passed, it actually went into action. So taking kind of that success and going to be looking at getting coverage for supportive care services for cancer patients. This is things like cold caps, cryotherapy, prevent hair loss, acupuncture to treat refractory pain syndromes and peripheral neuropathy. But what I was asked, there's notepads in the back, and there's index cards kind of scattered around the room. A supportive care, just write down what you can think of as a supportive care that we offer to cancer patients, because they want to make sure the bill is all encompassing, because more frustrating to put a bill and it gets passed and you gotta go back and edit it. Because that's the other thing we're taking to the state legislation is they're in the coverage of getting gene testing and the protection of the information of your genetic testing for cancer syndromes. We need to edit the bill to make sure it's completely protective, even in your information in the medical record. And that's the kind of the third thing CAGLA is going to take up for this legislative session. But as we're writing the bill for supportive care therapy, things you can think of that may fall into that realm. If anybody thinks of anything I didn't mention, if you can write it down, then before the afternoon is over, bring one of those cards to myself or Dr. Sheen. We're going to provide that to CAGLA and the P-card group as they write that law. So we're actually starting the afternoon session. I'm so excited about our lineup all day, but even this afternoon. So we're actually going to start with a state society. The Leukemia Lymphoma Society is probably great friends with all of us that are practicing cancer care, especially those that are treating blood cancers, our leukemia, lymphoma, myeloproliferative neoplasms, and multiple myeloma. And Katie Berge is here from LLS. She is the Senior Director of Federal Affairs. And our American Cancer Society this morning alluded to this topic, but now we're going to get the details on what would be the impact of the expiration of the enhanced ACA tax credit.
Dr. Finn, thank you so much for that introduction. I appreciate it. And for the clicker, that's also important. Yep, I'm Katie Berge. I work in our DC office. I cover congressional relations for the Leukemia and Lymphoma Society as it relates to access to care services, focused predominantly on Medicaid and the Affordable Care Act. And it's a pleasure to be with you guys today. Thank you for taking some time to tune in about tax credits. So before we get too far into today's discussion, just a little bit about the Leukemia and Lymphoma Society, or LLS. Our mission is to cure blood cancers, improve the quality of life for patients and their families. And we offer a whole bunch of different services as an organization to support blood cancer patients in the communities that they live in. First is that we fund an awful lot of research. We all know that breakthrough treatments and progression in cancer treatment is baseline started with research, and then you can't go anywhere without research funding. So it's something that we feel really strongly about it as an organization. But we also drive advocacy. So advocacy is the department that I work within. We work with state and federal legislators, regulators. We also engage at all levels in government to figure out how we can drive patient care and protections forward for our community. We also provide support, and I'm in the room with folks both from our advocacy department and our patient support team, including our clinical trials team, who help navigate patients towards clinical trials across the country, which is something that's really difficult to do. So that's just one piece of a bigger line of work that we do to support our patients. So, as promised, today we're going to talk a little bit about an issue that is pending before Congress that is of tremendous importance to the Leukemia and Lymphoma Society, but also to the broader patient community and even just consumer community. And that is the expiry of the enhanced premium tax credits. DC is the land of endless acronyms. I know that our medical professionals in the room are very familiar with acronyms, so we're going to call them, instead of EAPTCs and APTCs, we're going to call them the enhanced tax credits and the tax credits. So we'll try to keep things pretty straightforward. Before we dig in earnest, here's just a quick preview of where we're headed together here in the next 20 minutes or so. So today, our conversation is going to have a couple of pretty obvious conclusions, no-duh statements, for lack of a better word. And the first no-duh statement is that cancer care costs a lot of money, an awful lot of money. We know that within the first 12 months of treatment for somebody who is diagnosed with acute leukemia, it costs just shy of $500,000. This study that we conducted is almost 10 years old. So we know that the price has only gone up from here. So it goes without saying that access to high quality insurance that is also affordable is essential for cancer patients. And while there are many factors that impact a patient's ability to an individual's health outcomes, rather, we know that insurance and high quality, adequate insurance is a big part of that factor. For example, an uninsured individual is less likely to access the care than their insured peers. They are more likely to delay or forego treatment because of cost. But we also know that uninsured people receive lower quality care, i.e., fewer diagnostic tests, fewer therapeutic services, and have a higher mortality rate than their insured counterparts. And we heard from Dr. Pat this morning about how much work it takes as a physician to facilitate care for an uninsured individual versus those who are insured. So access to insurance is a big deal. Yet another very obvious conclusion. So why is LLS as an organization spends a lot of our time focused on how we can improve access to the patients we represent? And generally speaking, there's good news. This trend, this doesn't have a laser pointing, does it? Yep. Oh, the power, you guys. The trend is good, right? Like the uninsured rate is at an all-time low. And that's largely thanks to the Affordable Care Act and Medicaid expansion. The number of uninsured people has been steadily trickling down for a number of years. And that means that they can seek and receive services that they need to diagnose, treat, and manage their disease. On the flip side, again, a very obvious conclusion, is that today more than 24 million people get their health insurance through the Affordable Care Act. Insured numbers are at an all-time high in the ACA marketplaces, which is a big contributor to that all-time low uninsured rate. And the math is The math is real easy here. It can even be done with pictures, not numbers. The more affordable coverage more affordable coverage means more people can get affordable coverage. And that means better health outcomes for patients. While the ACA made a ton of great reforms, and we can spend all day talking about the myriad reforms to both quality of insurance, access, and affordability, today we're going to really focus on this affordability mechanism. And the mechanism that underpins that is the advanced premium tax credits. I said I was going to spare you from acronyms like all good DC lobbyists. I'm a liar. I know I said I would spare you, but we're going to talk about APTCs and EAPTCs. The advanced premium tax credits have always been a foundational part of the ACA, but they are exactly what they sound like, right? They're a tax credit that is provided to patients and consumers in advance of the end of the tax year. I think more than 90 people receive them on a monthly basis. They aren't sent to the consumer. They're sent directly to the health insurance company to defray the cost of their health insurance. The more money you make, the less generous the tax credit. The less money you make, the more generous the tax credit. And so generally speaking, so then came COVID, right? COVID was a moment where our country realized the importance that everybody should have access to health insurance. And we also saw tumult in the healthcare insurance markets. So Congress recognized that they needed to turn up the volume of the tax credits, thus the enhancements. So you'll see that this significantly decreased premiums for some enrollees. Now, people who are at this 400% of federal poverty level have been doing pretty well from this. It's good. But I want to just point out here at the other end, people who are making 100% of the federal poverty level, that's for a family of four. Family of four, that national number is $12,760. That is not very much money. So this amount of money, a few $100s a month in your ACA premium, is significantly out of reach for them. So I just want to make sure that we contextualize this. A lot of people benefited from the enhancements, but the people who benefited the most were the people who needed it the most. Okay. Thus, the lowest uninsured rate ever, right? Which is where we are now. So back in 2010, at the implementation of the Affordable Care Act, depending on what state you were in, most states were flirting with between 15 and 20% uninsured rate. And that varied somewhat. There are some standouts there, but nationally that hovered around 6%. Since the enactment of the ACA and Medicaid expansion and the enhancements, we're down real low. That's a historic number in our country. So that's really good news. I'm sure all of you guys are sitting here thinking this is too good to last, and oh boy, are you right, because the enhanced tax credits expire at the end of this year, which means there's a political environment that is already looking to slash programs like Medicaid. Again, Medicaid serves under-resourced communities, including those with low income and ultra low incomes. So we need to think about that. But on the other side of this, in the ACA insurance markets, people who hover around the Medicaid eligibility are those who are going to be hurt the most in this situation. So the political environment for healthcare coverage in this country, and I'm saying high quality, affordable healthcare coverage, because there's lots of coverage out there that isn't worth your money, is perilous right now. And so it's really important that all of us take an opportunity to reach out to our members of Congress to discuss the implications that this will have not only on patients, but on local economies and businesses. You'll see that this graphic here lays out the process by which insurance companies undertake an annual development process to get their rates in place. They work through actuarial analyses. They forecast who's going to enroll. And it takes a lot of time. They have to work through significant regulatory processes. They have to work with either their state-based marketplace or the federally facilitated exchanges to make sure that they are in compliance. They have to load it onto the websites, do beta testing. We all know how it worked out the first time we did this, and it wasn't good. So people are pretty committed to doing it right now. But there's this deadline right here, October 1st. October 1st is when the majority of people who are already insured in the ACA insurance marketplaces will receive their premium notification. They'll say that you're being renewed into your plan for next year, and this is how much your premium is going to increase. And nationally, the average of that premium increase is slated to be 93%. For people who are just under Medicare eligibility, particularly people who live in rural states like Vermont, Alaska, Louisiana, that can be as much as 400 to 900%. That's a lot of money, a lot of money. And so this is a big deal because nationally premiums are expected to increase a lot. And in a recent study conducted by the actuarial firm Oliver Wyman, an estimated 4 million people will lose coverage in the first year alone after this policy expires. Of those, almost 2 million will be enrollees with one or more serious chronic conditions. So they estimated that 8.3 million people in the ACA marketplaces have one of 6 very common chronic conditions, including arthritis, asthma, cancer, cardiovascular disease, COPD, and diabetes. If Congress fails to take action to extend the tax credits, almost 2 million of those folks will lose coverage. And it's important to remember that those are the people who can afford to lose coverage the least. Diabetics can't walk away from their insulin. Cancer patients can't turn down their chemotherapy. So, and again, a very obvious statement. When you're sick, you can't afford to lose your health insurance, but more than 2 million people will. So in the great state of Louisiana, where we both stand, where all of us stand right now, here are a few numbers to consider. There are north of 200,000 people insured via the ACA insurance markets in the state. I didn't know this before I came here, but 99.5% of all jobs, or all businesses rather, are small businesses in the state. And that means a lot of these folks don't have access to employer-sponsored insurance. Employers can't, especially small employers, can't always afford to extend ESI, and some of them are too small to do so. And so they rely disproportionately on the ACA tax credits to make care affordable for their folks. So this 200,000 people number also includes 16,000 children and 54,000 adults that are between the age of 55 and 64. Of the 210,000 people in the state who are on the ACA marketplaces, 203,000 of them receive a premium of some kind, a premium tax credit of some kind. Further, 26,000 small businesses and self-employed workers are also on the marketplace. In the first year alone, if Congress fails to reauthorize this, 64,000 people would lose coverage, and coverage for those folks who remain in the ACA marketplaces will get more expensive because the people who are in that risk pool are sicker and typically in poorer health, which means your premiums are more expensive. So it compounds. So those are some pretty compelling numbers, I hope. But unless Congress does something soon, patients will walk away from their coverage because they're going to receive that notice in October and they're going to say, no way. We know that patients, the vast majority of people who are in the ACA marketplaces shop based on premium. They don't shop on their deductible. They don't shop on their copay. They shop on premium. And so that number is very, very impactful. We also know that when somebody falls out of the ACA insurance marketplace, it takes between 5 and 10 touches from a provider, a navigator, an organization like LLS to get them back into the marketplace. So there's a huge threshold for reentry for these folks. And I think, I said this before, but the coverage losses are going to be in the millions. But the downstream ramifications of those include medical debt. A lot more people will be in medical debt, a lot more uncompensated care. Further, anyone who can't walk away from their coverage will be stuck in a health insurance plan that is going to be more expensive because the risk pool is smaller and sicker. Not good news for patients. So what about patients specifically? Well, LLS has been reaching out to our community, and the news is bleak. A lot of folks don't know that this is going to happen. When we walk patients through the tax credit expiry at the end of the year, they feel a tremendous amount of fear about the loss of this resource. And in a recent message to our advocates about the subsidy cliff, we had more than 200 responses in one day, just one afternoon, many of whom already struggle to afford the cost of cancer care. Like I said at the very beginning of this presentation, cancer care is already tremendously expensive. We are living in a time where there is a huge focus on cost. Eggs are a luxury these days. Healthcare is not a luxury; it's a requirement. So we've been reaching out to these folks, and I'm just going to share a couple of stories with you. But quickly, I'll just say, like, we're using pseudonyms for some of these folks because they have concerns about using their names publicly. But Tanya is a woman in her early 50s who lives in Mississippi with her husband and 3 daughters. Several members of their family have serious chronic health conditions that require regular checkups. In 2021, after struggling for years to afford their premiums, they enrolled in ACA coverage and said it was a huge blessing to our family. After learning that the tax credits would expire at the end of this year, she said, "My head spins. I don't know where else that money is going to come from. We have to eat. We have to live in our home." And she said that the loss of the premium would be devastating, and she fears becoming uninsured. Jessica is a woman who lives in Arizona with her 2 children, one of whom has been diagnosed with type 1 diabetes, and Jessica herself has a history of cancer. Both require daily medication and checkups that are costly, and while she doesn't describe her health insurance as the favorite part of her life, it allows her family to have access to the care that they need. After being told that her premium could increase by more than $300 a month, she said, "At that point, I would have to start making decisions. Do I pay my mortgage? Do I get gas or groceries?" And like so many parents that we talked to, she said that she would stop managing her cancer condition so that her daughter could have access to services and medication. "I truly fear for her," is what she said. Kenny is a father of 2 of ours. He was diagnosed with multiple myeloma in 2014. He is a fitness enthusiast in a way that I find truly irritating. He runs marathons and ultra marathons, but he noticed that after a long run one day, he wasn't feeling very good and he couldn't recover. The morning he was diagnosed, he had run more than 15 miles. Today, he is covered through the ACA, and after weathering hurricanes in North Carolina, cancer, and a lot of personal life upheaval, he is now able to access the routine services that he needs because of his tax credits. He just relapsed, and so this is more important to him than it ever has been before. These are just a few of the people that we've talked to, and you'll see some others here are on the screen, including a man who doesn't wish to be identified other than MM, saying that he used to faint all the time because he had to ration his diabetes medication. And since he was enrolled in the ACA, he doesn't have to do that anymore, including being picked up off the street and returned to emergency departments more than once. So together, the evidence and the experience of our communities underscore why this is such an urgent issue for patients, and we really need Congress to act. And I want to pause here and just say the ACA is only one part of our coverage fabric in this country. The enhancements have brought more people into coverage than ever before, but we are in the middle of a congressional debate where we are talking about serious cuts to services and coverage numbers for the Medicaid population. So these 2 things are coming at the same time. We are talking about eliminating a lot of care through Medicaid by any number of mechanisms, all of which, every single one of which, will reduce access to coverage, cut services, and seriously impact patient communities, whether it's expansion or non-expansion. At the same time, we are taking away one of the only affordability mechanisms for people who want to buy insurance on their own in the healthcare marketplaces. So the compounding impact of that yet has not been estimated. We haven't seen any proposals on Medicaid that the CBO can score, but it will be devastating to the fabric of our healthcare coverage in this country. We are turning gaps in coverage into gorges for patients to fall into. So what are we going to do about it? I am so glad you asked. These are all our friends. LLS, in partnership with more than 40 patient organizations, all national, nonpartisan nonprofits, have long defended and advocated for the ACA because of the protections that it offers to our community, which is why we strongly supported the enhancements in 2021, and it's why we want to continue to keep them. So why we are banging down Congress's door telling them that they must act now is because there's good news, and we have some strong polling to back us. 82% of people surveyed on extending the enhanced tax credits agreed that they were critically important. Large majorities across parties reported favorable view of the enhanced tax credits. And 83% of people surveyed said they wanted to end efforts to undermine the ACA, including 68% of Republicans. We also know that north of 70% of Republicans have said that access to high quality insurance is one of their top 3 voter issues when they go to the ballot box. It's how they make decisions. We also know that 78% of Trump supporters surveyed in this study supported the enhancements of the tax credits. And I think it makes a lot of sense within an agenda where Congress feels very strongly that they are here to reduce costs for American working families. This is a mechanism that we can draw real value for working class families in this country that aligns with driving down costs. It's great to have good polling behind you, especially on issues like this. So again, we have evidence, we have experience, and we have popular opinion. This is all going really well. As a lobbyist, I won't shake a stick at any of that. This is my dream, to have all of these things behind us. So there's a lot of work to be done. Nevertheless, there's a lot of work to be done, and I'll leave you with a brief video that talks a little bit about this issue. And you're going to be mad that a 62-minute video could have summed up 30 minutes that I just gave you. But this is great, and it's something that we would welcome you to share with your communities.
Life is expensive. Everyday costs are on the rise, but there are some essentials we can't go without, like health insurance coverage. Unless Congress acts soon, health insurance could get a lot more expensive for the over 20 million Americans who buy it for themselves on the Affordable Care Act marketplaces. That's because, right now, many families and individuals who can't get health insurance through their work rely on enhanced tax credits to purchase coverage on their own. In 2021, Congress increased existing tax credits to make coverage even more affordable. These enhanced tax credits make it possible for people to afford high-quality health insurance. But they're set to expire later this year. That means monthly insurance premiums will skyrocket for millions of Americans. On average, premiums will rise by 93%. Congress has the power to help, and Americans can't wait. If Congress fails to take action and renew these vital tax credits, patients and consumers will pay the price. Millions of people will lose health insurance because they'll no longer be able to afford it. This includes 2 million people living with pre-existing conditions like cancer, heart disease, diabetes, and other serious illnesses. Patients who desperately need health insurance could become uninsured, and millions of people will pay more for their premiums, a lot more. Older Americans, people living in rural areas, and patients with pre-existing conditions will be hit especially hard. For many, the consequences of going without health insurance could be deadly. Hardworking people cannot afford to lose this important tax credit at a time when costs are already so high. We're telling Congress to extend tax credits. Join us at lls.org/tax credits.
So you guys have heard me say these tax credits are transformational for our patients, because they are. Many, many of our patients can't have access to any form of insurance without the enhanced tax credits. So I hope you'll consider joining us in advocating for this issue. You can find out more about LLS's activities at lls.org/advocacy. And I'm happy to take questions, but I know I'm over, so I'm going to keep... Okay. But thank you so much for this opportunity. It's been a pleasure to talk with y'all.
Questions?
Don't all fight for it.
So if we go to the LLS.tax credits site, what happens?
You can sign up to be one of our advocates. One of the things that we would love, if this issue speaks to you, which we sure hope it does, we'd love for you to sign up for our advocacy work through the lls.org/tax credits. Talk to your member of Congress. Dr. Pat did a great job about talking about how the relationships that you build with your members of Congress and with your local legislative officials is so important to conveying a message that really resonates with those communities. You know, when you hear it from somebody you hear it twice as loud. And so would really welcome you into the fold. Come be one of us. We have a whole bunch of resources to support your outreach to your member of Congress, including training materials, how you can attend a town hall, how you can write your legislator, call your legislator, meet with your legislator. And we do a lot of great work both at the state level and at the federal level. So that's where that will land you, in a whole lot of trouble.
I'll dominate the microphone. I have a second question. Yeah. So I'm a provider and I'm a hematologist. So if a patient approached me because they have discovered these changes may be happening, what resources could I guide a patient to either learn more or maybe talk to someone through the issues of what to expect? Either way this may go.
Yeah. So that's a hard conversation to have, particularly with the uncertainty that we have before us in Congress. You should point them our way. One of the things that, and I'm going to pick on Jennifer Champagne. If you would raise your hand really quickly. Jennifer is our advocacy guru here in Louisiana. Send them our way. We can help find other options for coverage to the extent that there are any. Like I said, there's not a whole lot. Dr. Pat said it's terribly hard to find coverage options for people who are payment options for people who are uninsured. But we need the people who are going to be impacted to be talking about this. And Jennifer facilitates those relationships for us. We need stories. People with lived experience move the needle in a way that I cannot with all of mine. I know you're going to go to bed tonight thinking about my bar graphs, and I am so flattered. But the stories are really the bits that matter. And so, we want to make sure that we can facilitate their voice being heard by the people who are making decisions on behalf of our community. But it's a challenging moment. Okay.
Anyone else? All right. Thank you.
Great. Thank you so much.